Hello friends, and welcome to the second part on the Bristol Stool Chart. In this video I'm going to explain each one of the 7 parts of the chart and its influence on the digestive system. So let's jump right in. Stool type 1 is formed of lumps hard stools. They come in a small diameter of 1/2 to 1 inch. Due to the hard and rough texture, those lumps are painful when exit and can cause bleeding from the anus. Severe constipation accompanies this type of stool. Here, there is a deficiency of friendly bacteria and dietary fiber. Babies can suffer from it in the first months of life, especially those who were not born in a natural vaginal birth or were not breastfed during infancy. Next, type 2 looks like a mass of small lumps clumped together. This type is found in chronically constipated people. The diameter of this stool ranges from 1 to 2 inches. This diameter is close or past the maximum natural anus opening, which is about 2 inches. This type can increase the risk of anal fissures, hemorrhoids, pelvic floor prolapse, inflammatory bowel disease, cancer, and more. In order to get type 2, feces need to stay in the colon for several weeks before it comes out. In this condition, the person has had chronic constipation for a long time. Because of the constant pressure on the walls of the colon, this stool type can cause irritable bowel syndrome, which is followed by inflammatory bowel disease. In some cases, a blockage can form in the small intestines because the colon is already full of feces and there is no room for more. In this condition, a fiber supplement can be harmful because the fibers absorb water and swell, and feces have nowhere to go. I want you to pay attention to the following. I'm not talking here about the frequency of bowel movement, but about the texture and shape. In general, someone who has type 2 can have a bowel movement once a week, but it can also be twice a week or once every other week. Even though the frequency of bowel movement is important, the texture and shape determines the length of time stool stays in the colon. Now, type 3 has all the characteristics of type 2. The difference is in the time the feces stay in the colon. In this type, it can range from 1 to 2 weeks. Here too, there is a chronic constipation and strain applied while defecating. The diameter of type 3 ranges from 1 to 1.5 inches. The only difference between type 2 and type 3 is the time stool stayed in the colon, when type 3 spend less time than type 2. Next comes type 4. People with this feces have a bowel movement once a day or once every 2 to 3 days. The diameter of type 4 usually ranges from 1/2 to 1 inch. Larger diameter and harder texture means the stool stayed longer in the colon. Thick and firm formation causes strain during defecation. For many experts, type 3 and 4 are good bowel movement. Now, if you have any one of the first 4 types, I think you should improve your lifestyle. I urge you to do it before chronic disease set. The health puzzle talks about the 7 elements that govern our health. I'm sure you can get there important information about healthy lifestyle. Now, to some extent, people with the first 4 types eat a lot of fiberless processed food. They take antibiotics and they don't engage in physical activity. Perhaps type number 5 should be the most ideal. This type resembles someone who has 2 to 3 bowel movements a day, as the number of full meals he ate that day. The diameter of this stool is about ½ an inch. This type does not require much effort while defecating. Many vegans report having this type due to a diet rich in fiber and healthy lifestyle. In study conducted in cultures around the world, this type has been observed in developing countries. The main reasons for it are the natural food they eat, their active lifestyle, and the squatting toilets they use. Let's move now to type 6. In some respect, this type can be the boundary line between an ideal stool and an overactive digestive system. There are several reasons for having that kind of feces. Diet rich in potassium may cause looser stool, but it can also happen when chronically not drinking enough water, or a sharp rise in blood pressure due to stress. Drugs, antibiotics, and laxatives can also create loose feces. When peristalsis moves faster, less water absorbed by the colon. Therefore, the feces have more liquid in it. Stool type 7, as everyone knows, is diarrhea. Usually, diarrhea happens because of infection in the digestive tract from contaminated food or from chronic inflammatory bowel syndrome and diseases like Crohn's. But there's another reason for diarrhea. Science calls it paradoxical diarrhea. It occurs mainly in infants, children, and in adolescents. It happens because of fecal obstruction, which is common condition for type 1 and type 2. It is called paradoxical diarrhea because while someone has diarrhea, he actually suffers from constipation. This is definitely a paradoxical condition, and unfortunately, this condition is common. Paradoxical diarrhea also appears after a period of severe constipation. After the end of the diarrhea, constipation reappears again. The doctor might determine that the patient has irritable bowel syndrome, and with the help of antibiotics, the road to inflammatory bowel disease is short. However, now you know that hard feces can be small, normal, or large. If one suffers from hemorrhoids or fissures, even small stool will be difficult to pass. In conclusion, if the stool is compressed and hard, and if you are straining while defecating, then to some extent you are constipated. If stool is uniformly shaped, like in type 1 to 4, there is an accumulation of feces in the colon. I also want you to know that a normal stool for someone is not normal for someone else. You will know what a normal stool is for you when it comes out without a long sitting on the toilet or straining, and it still be full in volume. Clinical constipation or chronic constipation occurs when there is less than 1 bowel movement every 3 days, or 2 to 3 per week. In medical practice, the term constipation has become vague and non-specific. The use of medication and laxative causes dependence, and they don't solve the root cause of the problem. Now the power of knowledge is in your hands. Changing your lifestyle and squatting during defecation seems to be the only permanent natural solution. The best thing to do now is to take action. Below this video, there is a link to purchase the All-American Squatty Potty. When buying it through the link I provide, you help to support my educational programs. Do it now for you and for the next generation. Goodbye.